right, I think I am recording now. All right, well, welcome everyone to the PE46 webinar, closing out FY23 and getting ready for FY24. If you haven't had a chance already, go ahead and introduce yourself in the chat box. For those of you who I haven't met or emailed with, I'm Becky Greasy. I am the Program Integrity and Operations Specialist here at the Reproductive Health Program. And I'm joined by my colleague, Emily. Emily, do you want to say hi?
I do, if I could unmute myself. Hi, everyone. My name is Emily Ellman. I use she, her pronouns. I am the Senior Policy Analyst with the Reproductive Health Program and just here to support Becky during today's webinar, and we'll be monitoring the chat.
Great. So over the next about 45 minutes to an hour, we're going to cover a few things. One, we're going to do a quick icebreaker. Then we'll have a discussion around the PE46 changes and time for breakouts. So you'll get into small groups that I've already kind of picked out based on a variety of factors. And then we'll talk about what's due and when it's due. So to get us started, I want to do a quick icebreaker. People can put this in the chat, or if you're feeling like coming off mute, that would be great as well. You can also raise your virtual hand if you want, and I can call on folks to come off mute. But we want to hear about one success and one challenge that you've had over the last year with your PE46 work. And if you can't think of a success and a challenge, if you just want to share one of them, that would be great. So feel free to come off mute if you would like and share, or use the chat box.
This is Lindsay from Clackamas County. I can share a success.
Great.
This last year, we actually partnered more than just our regular, RH providers. We actually contracted with Planned Parenthood and Cascade AIDS Project, and they provided education in the community and some workshops with some community-based organizations. So it was our first year partnering with them, and they went really well. So we're excited to partner again in this coming year.
Great. Thank you so much, Lindsay. What about other folks who want to share?
I can share. This is Randy from Winding Waters Clinic in Eastern Oregon. So we were able to meet with a partner organization, the Center for Wellness, and they have counselors in the school. And so we were able to just share more specifically what services we offered and how they can make referrals to us, or how they could get in contact with us directly. And we had one neat situation where we were able to provide services to the patient at the school. And so we could do that pretty seamlessly. And so that worked out really well because, they were aware of our services. So.
Great. Thank you, Randy. It looks like we have some in the chat box that I'll share back with folks. So we have Lindsay said they were trying to hire for most of the year and got derailed with a couple of times, but I'm excited to our new staff is here in the meeting today. So that's great. I know a bunch of agencies had problems with staffing over the last year. Amy shared, we got to know our local school nurses much better, but implementing any programs has been difficult due to political barriers. I know if there are others who are also facing similar barriers, maybe you could get in the chat box and introduce yourself to Amy, because I know Amy is interested in connecting to folks who are experiencing the similar difficulties. Let's see, success from Anne and Benton, community presentations. Challenge from Lillian, maintaining full staffing, success, restarting our RH coalition to network with other Umatilla County providers. It's great to hear. From Kristen, we have a success. We participate in a regional perinatal task force and we're able to host 6 training sessions surrounding RH and well woman care for our partners. And then we have Virginia. A challenge was having to pick up programming after staff moved on and having to redo some things that did not make sense for our area. Success, able to get team council together for insight on RH services. Great, great. Anyone else want to share that wants to come off mute? Share it loud.
Hi, this is Carol from Multnomah County. We had a really successful project this year, partnering with a DNP student from OHSU and the Center for African Health and Education. And with a group of Somali women, we had a really fabulous turnout for an education session, and the student is continuing work even after the project was done, working with that community-based organization, working on some other projects with OHSU. But it's really opened up a new partner for Multnomah County, and sharing that information that we learned from them with our providers that provide care for the Somali community.
Great, thank you, Carol. All right, great, everyone. Thank you so much for sharing both challenges and successes. We're gonna go ahead and dive into the changes that have happened over the last year or so with PE46. So about a year and a half ago, RH program staff started discussing potential changes to the program element. We wanted to clarify some of the components and refocus some of the PE46 work. So we embarked on making changes, getting some feedback, and then going through the approval process with Chloe. So while we would say that there's no drastic changes, you may all feel differently. So you can tell me after the presentation, but we've made a few tweaks and taken some things out. So the first change is with the goal. Now, if you look at it, it may not look much different than it did this current year. It still is about assuring access in your community. The only thing we added is the how component. So we're indicating that you all are assuring access through developing partnerships and policies and program changes that address the barriers and gaps. So that's one of the changes, the goal. The next change comes in the number of program components. As you know, we have 4 program components currently in this fiscal year. We have the 3 seen on the screen: partnerships and community engagement, assessing gaps and barriers, and I believe the wording for the 3rd component is actually implement a strategic plan, which is developing solutions basically to the gaps and barriers. We also had evaluation as the 4th component. So the intent has been over the years that an agency would pick a component to focus on, with the idea that you would kind of move through the different components year to year or every couple of years. And so what often happened was that evaluation often got left out, and that can happen for a variety of reasons. So we decided to think about evaluation differently, and instead think it could be embedded within these 3 primary components that you see on the screen. So we're going to focus our efforts on, or your efforts and what you choose to work on these 3 components. And then we hope with the new annual plan template that it will somehow it will help embed evaluation into it to a certain degree. Like, we're not doing some major rigorous evaluation. So some of it might be more processy related evaluation, but as you move through and start developing solutions, we really want you to consider how you might evaluate the success of those components or those solutions. So we're going to go through each of the components and talk about any changes or how things have stayed the same. So one of the things we decided to do was refocus on partnerships and community engagement. We felt that it was often something that could get overlooked easily, either in our communication to you all or in annual plans. And it really was kind of the original intent of PE46. So this year we decided to highlight this component and require you all to have at least one objective under partnerships and community engagement. We know that partnership development, relationship building, maintaining relationships can take a lot of time and effort. And for some, that may mean that you are focused solely on this component for this year. However, a lot of you already have some well-established relationships, partnerships, coalitions that may not need as much time kind of growing them. They still need time to support them and to keep and maintain them. But you could focus on some of the additional components as well around assessment or solutions. Partnerships will look different across all of your agencies. Like I said, some of you have well-established coalitions or work groups like Washington County and Coos County. Others of you have formed partnerships, some of which you've already mentioned, with schools, correctional facilities, other public health programs like WIC, with mental health providers or culturally specific community-based organizations. And some agencies like Lynn County have used innovative ideas to build partnerships in hotspots where community members are having the most barriers to accessing care. And then others have decided to focus on specific populations like youth. Malheur had developed a youth advisory board this past year. And I know someone else also mentioned a youth advisory board. So partnerships look different for everyone, but we are asking that agencies have at least one objective under partnerships. Component 2 really hasn't changed. It's still about assessing the barriers and gaps in reproductive health services. So we want you to work with those established or new partnerships, coalition work groups, to determine how you would like to conduct assessment and to work with partners in actually conducting an assessment. So an assessment can look different, just as the partnerships can look different across agencies. So that might mean developing your own surveys, conducting focus groups, doing key informant interviews. You can also find out what other assessments are currently happening in your community and see if there would be a way for, and if it would be appropriate for you all to include questions or be a part of that assessment process to determine barriers and gaps in RH services. So we are really open to your ideas on how you want to do this assessment. Some examples of what agencies have been doing around assessment include, as I mentioned, Malheur, they are working with their youth, have been working with their youth advisory board to develop a survey to assess the barriers, and then working with those same youth to get those surveys out through their high schools. Carol already mentioned Multnomah County and the work that they have done with their doctoral students to better understand the needs of the Somali population, and have done listening sessions, needs assessment, and then working with the culturally specific community-based organization. And others of you have used community health assessments that are already happening in your community and add on questions or use that data to better understand the barriers and gaps. Component 3 is about developing and implementing solutions based on what you found in your assessment. So component 3 should only be tackled after component 2 is complete. We want you to continue to work with the partners to develop solutions and plans for implementation. You'll also want to consider how you might evaluate these solutions that you're coming up with before you implement them. And another thing to keep in mind is that you don't already have to have the solutions identified. So if this is an area you want to work on in the coming year, you don't have to have the solutions identified. You can just develop objectives and activities related to getting to those solutions, because coming up with those solutions can take time as well. And this may be a component you're working on for a few years. It's not kind of a 1 year and you're done necessarily. over the past year, folks have come up with a variety of solutions to implement that may be related to survey or assessment results. Deschutes County, for example, did a survey in FY22, and the survey results showed that there was a lack of awareness about available reproductive health services and access to birth control in their community. So this past year, they developed PSAs in English and Spanish that were then put out in the media, over TV, and all did that through PE46. So besides the refocus on partnerships and community engagement and the removal of evaluation as a separate component, we made a few other changes. We removed some duplicative content. We removed the effective contraceptive use metric. We did that for a few reasons. One, it's not really an appropriate measure for this project. And in addition, FAB will be reviewing and updating metrics over the next year or so. So we want to wait to see what they come up with. We also updated the reporting requirements to include everything we already request from you. It just wasn't identified in the description of the program element, and so we wanted to be accurate. The annual plan template has also been updated. So we have taken it out of Smartsheet and we have made it look more like what you might expect for a work plan, like for a grant or other funding. The template is in Word. You all should have received it. If you did not receive it, if you could just put a note in the chat. They are linked on our website as well, so you can access them easily. But this is what the template looks like. You will see that each component has a space for at least one objective. So if you're going to have more than one objective for a specific component, you're going to need to copy and paste this table again below it. And if you're going to have more activities than there are already rows in the table, you just need to insert more rows. If you have any trouble with the template at all, please let me know. But hopefully it's fairly easy to use as it's in Word. So each component already has an established goal, so you don't need to change the goal for the component, but you do need to establish an objective. We would like objectives to be SMART objectives, so specific, measurable, achievable, relevant, and time-bound. Then you'll need to list out all of the activities that it would take to achieve that objective you chose and indicate who is responsible for that, or if it's multiple people, or a team, the timeline for completing that, what resources you might need. So it might be budgetary resources, money, which then you can connect back to the budget you submit. And then expected outcomes or activity outputs. So kind of one way to look at evaluation is through this section. There is in the template an example. There's two examples of like completed plans for different components. So as you can see here, the objective has been identified. There's a time frame, it's specific, it's measurable, it's probably achievable. So it's definitely falling within that SMART framework. And then it's identified the different activities that need to achieve that activity. So please feel free to take from this example, use it as you're developing your own plan. And of course, reach out if you have any questions or if you're struggling with anything or want some feedback before you submit it, feel free to reach out. And the budget template, the only change we made to the budget template was to add some describe under professional services and contracts, travel, supplies, and other. This is really just meant to help reduce kind of a back and forth. If you have a line item like under professional services, it would just be great to know in the budget what that is attached to. That way we don't have to go back and forth over email about that. Just so that it's easier for us to connect the budget to the annual plan you submit. I did include in the email kind of what your annual funding is for PE46. If again, If you did not get that, let me know so we can get that to you so you can use that as for your total. So those are all of the changes for PE46. What questions do people have? Well, hearing none, I'll keep going, but feel free, of course, to use the chat if you come up with questions. And then we're also we're about to get into some breakout groups. So you can use this time to discuss anything that's come up and from the previous slides that I've talked about. But in small groups, you're going to first, of course, introduce yourself to each other and how long you've worked on PE46. There's a range of folks who have been doing this for many, many years and some who are brand new. Share your initial thoughts on what you think you're going to work on for FY24. And you can also use this time to talk about any challenges you're experiencing or concerned about in your community. So really use this time to connect with each other. And then what questions do you have for the larger group or for the RH program or support you might need? So if you do come up with, and questions for the larger group might be like, how did you do this? Or who's done this? And so that you can get connected with those folks. Or if there's things that you need specifically from the RH program, let us know too. So if you do come up with questions, please share those back when you guys come to the larger group, back to the larger group. You're gonna have 15 minutes. So I will, let's see here. I'm gonna stop recording for this piece. I'm gonna try to stop recording. Oops. All right, well, folks should be coming in. My timing got off a little bit on that one. They should be coming back now.
I have to jump off in like 3 minutes. So.
All right, well, welcome back, everyone. I hope you all had a chance, had some good discussions. Were there any questions or anything that came up that folks wanted to share back with the larger group?
Our group really discussed, well, we started to talk a little bit about school-based health centers and what's worked, what hasn't worked, and the pushback we're getting from school districts and to provide certain services, whether it's supplies or education.
Sure.
I'll jump onto what Yvonne just said as well. We talked a little bit about the student-based health center and having like access to teens for focus groups and reaching out to them. And in the smaller counties, something that you guys in the metro area don't have to consider is the people who don't like what we're doing or saying know where we live.
Right. Yep.
Yeah, that's a really great point. Any others? All right, well, if as things come up, please reach out. I wish I had like had a solution for you, Lindy, and I think others who kind of chimed in that that was like an experience that you all have. I don't have a really good answer for that right now, and I like feel for you in that experience, and I've heard that from other folks over the last few years, just with COVID and as well. So, folks, go ahead.
Oh, no, I was just gonna, I mean, this is a little bit of less about the politicization of your work and more about specifically working with youth. Our adolescent school health unit has just stood up a statewide, youth advisory council, but has also been working quite a bit with local communities around setting up yaks. And I think they have some great lessons learned. And I wonder if, if this is something of interest to folks, we could try to facilitate. I mean, I'm sort of offering up the folks in adolescent school health without asking them first, but I think that they would be open to sort of sharing what they know, their wisdom, and answering questions and doing some brainstorming. So we could think about how to facilitate a short webinar or, office hours or something. So let us know if that's something that would be of interest to you all, and we can work on making that happen.
I think that probably could be useful for people. I think it's not just in the youth realm, though. I think that in the climate that we're living in right now, with all the politicization that's going on, just even talking about reproductive health in the community can trigger a lot of thoughts for people, and they don't all necessarily agree with the work that we do.
Yeah, we could take this back to the rest of our team and have a discussion about how we can, what other supports or thoughts we have about that in terms of that challenge. All right, thank you all. So to wrap up, we're going to talk about kind of next steps. So what's due and when. We have the wrap up for FY23. So your final report for this fiscal year and documentation is due June 15th. With an asterisk there, if you need more time, or if there's something that, like if you're partnering with someone and they have something due to you, but it's like not in that same time frame, just let me know, reach out if you need more time. That is going to be submitted via Smartsheet. There were instructions that were sent along in the email that kind of goes through each of the questions. It has a link to the Smartsheet, which you also see here and is on the slide deck. You will attach documentation for each objective that you accomplished over FY23. So that can be meeting minutes, it can be a survey you developed, it could be materials you developed. 1 to 2 pieces for each objective. Then we have FY24 annual plan and budget, which we talked about a bunch earlier. That can be submitted via email to me directly. That is also due June 15th, again, with the caveat, if there is extenuating circumstances or reasons you might need a extension, let me know. You'll use the new annual plan template, which is a Word document. It does have like a little kind of button at the bottom that says click here to submit, and that just should open your email up with it attached to your email. Then you can add the budget template, or you can just like do how you would traditionally add an attachment to an email. There are instructions in the template for you, and then there's the fiscal guidance document that you can refer to as you're completing the budget template, things about like not including clinical services or clinical service staff if they're doing clinical services. But that fiscal guidance should pretty much be the same as what we've had in the past. So that wraps it up. That's the FY23 final report and documentation, and FY24 annual plan and budget will be due June 15th. If you need like a copy of what you've submitted this past year in terms of your annual plan or progress report to help complete your final report, let me know, and we can get a copy of those to you. But otherwise, questions, what questions do folks have? If there's no questions, I feel like you know how you can reach out to me, and you can reach out to Emily as well. But we are here to help support you all, so feel free to reach out. I will be sending out a copy of the slide deck and the recording to all PE46 coordinators to share with any staff that may not have been able to attend, or for folks that weren't able to attend that were PE46 coordinators as well. So look for that in the next few days. But otherwise, it was great to see you all and hear from you all today. And I hope you have a great rest of your week. Thank you.
Sorry, I